So our trials have benefited from the recent neutral trials in that it's reset the level of equipoise, and patients were mostly randomised into the trials rather than the best candidates being treated outside the trials, which I think was a problem for the earlier ones. These devices clearly are more effective. The rate of opening the artery in IMS3, for instance, getting 50% or more blood flow restoration was 40%, and you compare that to the high 80s that we've seen, 86% in our study, 88% in the SWIFT Prime study, slightly lower in ESCAPE, but all highly effective therapies. That's an incredibly interesting and challenging issue that we all have to face. So obviously the centres that were doing in this trial can implement immediately. They can just carry on what they're doing, but we need to have some sort of political discussion about strategically locating comprehensive stroke centres throughout the population so that we do get coverage, and we need to have systems of rapid transport, whether that's road ambulances or helicopters or whatever. Patients who are at a distance need to be able to get to a comprehensive centre quickly. I think these trials were performed across a broad range of populations, and I think that would generally apply. There are some differences, particularly in Asia and India. There's a lot more intracranial atherosclerosis, and we've mainly been dealing with normal arteries in the brain that have just had a clot lodge in them that's come from the neck or the heart. So if you've actually got an underlying abnormal artery, that's a bit more like the cardiac situation. Whether these stents work quite as well in those patients hasn't been clearly established. So I think still the basic treatment is TPA. So anyone who's within 4.5 hours and eligible for TPA should get that as their first therapy. And then if there's a major blocked blood vessel, they should be considering this. And exactly how we select patients, exactly who is excluded on the basis of a large irreversible area of damage is still yet to be determined. I think the default is, if there's a blocked vessel, think very carefully about why not get it open. I think these trials are definitive. You've got Mr. Clean, the results were clearly statistically significant, the absolute benefit wasn't as great, but these 3 trials with slightly better selection are unequivocal, and it's time to change the guidelines and make this standard therapy.